Well, hello Transformers. What is the crack? I'm going to be joined by the wonderful Oonagh O'Hagan on a live this evening to celebrate all things Symprove, because there's 25% off the 4 and 12-week programmes until the 30th of June to celebrate World Microbiome Day. So if you're thinking about picking it up, or you're in fact topping it up, now is the time to do it. So I have a link in my stories, there's no code needed. But I'm going to chat with the wonderful Oonagh, who is from Meaghers Pharmacy. She's the MD and she's also a pharmacist. So she's going to go through the questions that I get quite often. And if you have any questions here in the live, some good things as well. If you purchase the 12-week programme on this live, put your order number in, because she doesn't know yet. She's not on yet. But I'm going to ask her, will she refund one of the orders, or we might get a little 12-week giveaway or something like that. So let me know what you want in the comments and I'll do my best to ask her. So why I asked her on was because there is so many people asking me different questions that I'm like, this is the answer, but Oonagh is able to go into it in a little bit more detail and a little bit more depth. So to celebrate World Microbiome Day, from now until the 30th, there is 25% off, which is unbelievable. Revive Active, all those little bits. But to celebrate the World Microbiome Day, it's 25% off the 4 and the 12-week programmes. So Oonagh's about to join me there.
Hello!
Hello, my girl. How are you, man?
Hello! I'm very well. I'm in my old bedroom in Plumbridge.
I see you're up home for a few days, are you?
I am. I'm up home, yeah, giving a wee hand out to mummy and daddy. So yeah. So I'm up home. So hopefully the reception will be okay in the hills of Tyrone, Trisha.
I know, it'll be gas. I was only thinking earlier, I don't think I've ever been to Tyrone.
Oh, you have to come. Open invite. Come on ahead to the Plum.
Happy
Love to
days.
see you.
And come here, thank you for coming on, because I know you're up home, and I was like, would you mind doing live? Because it's just easier. With the big massive discount that's on, there's so many questions coming in. People want to top up, and things have changed a little bit within Symprove, like the dates and the 4-week being sent afterwards, and there's so many different newness that I think it's just easier to sit you down for a half an hour and see how we get on.
No problem. Yeah, I'll answer whatever questions you have. No problem at all. And if anybody has any questions, ask them. And if not, because I know we always say, Trisha, a lot of people don't like asking about gut health questions, or if you're on medication, whatever, you can just send me a DM afterwards if you want to tag me, Trisha. And what I can do is answer you privately if you would rather not ask publicly. So it's no problem at all.
100%. So we're celebrating World Microbiome Day.
Yes.
Will you just say exactly what the gut microbiome is and how can you support it? That's just the easiest way to start.
Okay, right. Okay, so the gut microbiome. Well, first of all, the gut, because often people say your gut is down here, like, below your tummy. It's not. It's actually from gum to bum. So really from your mouth all the way through your stomach, esophagus, stomach, small intestine, large intestine, and then your rectum and your anus. So that is all your gut, yeah? But the bit that we're interested really in when we talk about the gut microbiome is the large intestine, because that's where most of your microbiome is. So the term microbiome basically means it's like an umbrella term, Trisha, for all the bacteria in you, all the viruses, protozoa, and fungi in you. So that's what your microbiome is made up of, but most of it is, 90% of it is bacteria. So when we talk about microbiome, we're talking really about the good bacteria in your gut, and most of them are in the large intestine. So at the very end of your gut, just before your rectum and your anus. So that's the bit where the microbiome actually is. So all these gut supplements or whatever probiotics need to get the bacteria that's in them to that area in order for it to really be effective, be optimized. And the trouble with that is, as you know, because me and you've talked about it so many times, so many of these freeze-dried bacteria supplements, whether it be capsules or powders, whatever, are freeze-dried. So the bacteria are like kind of frozen, do you know what I mean, like in Star Wars, like whatever, in time. And so in order for them to be effective and start moving around again, they need to be brought back to life, reconstituted is what we say. So in order to do that, you need to put them into water. Now, the problem with capsules and powders, when you take them, the first thing that they hit is your stomach, and your stomach is full of acid. So very often the acid gets into those bacteria because they're dried out, if that makes sense, and gets into it, and then the acid kills the bacteria. So a lot of the supplements don't even make it through the stomach at all. But Symprove is very different. As you know, it's water-based. Yeah, water-based. So the bacteria are not freeze-dried. They are swimming around in this all of the time. They're feeding off a little bit of germinated barley, but the gluten has been removed from that barley because people kind of go, oh, is there gluten in it? No, so the gluten has been removed, but they have a food substance in this, and they're swimming around, so they're live. They don't need to be reconstituted, and because the majority of this liquid is water and it's pH 4, that basically means that it is the same acidic concentration as your stomach. So they are essentially used to living in an acid environment. So therefore, they don't get killed in your stomach by the stomach acid. And all of your shot of Symprove, which contains 10 billion colony forming units, 10 billion bacteria in each shot. Yeah, 10 billion in each shot. When you drink it, as long as you have it first thing in the morning, well, you can, if you're night shift, you can take it later. But as soon as you wake up, and your acid levels are at the very lowest, as long as you do that and don't eat or drink anything other than water for 10 minutes, then your stomach thinks this is water, yeah? And all of the bacteria pass through the stomach and into the small intestine and then into the large intestine to repopulate your gut. So it really supercharges your good bacteria in your microbiome so you can see those effects super fast. That's what Symprove does.
Exactly. So 100% of that, when taken properly, will reach your gut. So that's why the price difference is a little bit more than what if it was a capsule or anything. That makes total sense. Can I ask a favour? Can I do a giveaway on the live?
Of course you can.
So I just think it, whoever's on the live now, if you share it to 1 or 2 people, put a comment in that you've shared, we'll pick one winner for a 12-week program, which is worth €200.
Yeah, perfect. No problem.
We do that?
Yeah, delighted.
So get sharing. You can press on the bottom right a little arrow going that way and pop it in when you've shared, and we can go through it. Before we continue on, I will answer the questions throughout the live. I have a couple of them wrote here that someone sent me, but Josephine wants to know: do you need to take silver with Symprove, or would seeds and nuts give you enough fibre?
Yeah. So basically, these little bacteria in Symprove, or the bacteria in your good, in your large intestine anyway, in your microbiome, in order to make them to grow, right, and to thrive, they need what we call as a prebiotic. So basically, a prebiotic is a fiber, and you can get fibers from nuts and seeds, fruit and veg, whole grains, legumes, lentils. All of these have fibers in them, Trisha. But silly flour, what that lady just asked about, you don't need to take it with it. It is a really good source of soluble fiber, however. So if you up your fiber intake when you are on Symprove, you will see the results so much faster. And we always say, try to get it from your diet because you want to have diversity in your food, if that makes sense, because you have loads of different species of bacteria and they all prefer different fibers. So diversity is really, really important. However, if you struggle to take 50 grams, and the advice has now moved to just be 30 grams of fiber a day, Trisha.
Okay.
Now it's depending if you're male or female, anything up to 50 grams, and it's very difficult to get that in your diet, particularly if you have IBD. So any patients who have IBS or IBD tend to stay away from trigger foods, as they would call it, because they trigger their symptoms, and so they start eliminating a lot of fruit and vegetables and different things that would set off their symptoms. So they particularly really struggle with that, and I know that because I used to have really chronically bad IBS. So I used to like, oh, I can't take garlic, can't take peppers, can't take chilies, can't take this. And so I was eating very limited fruit and vegetables at the end. So when you have very, very bad IBS or IBD, our experience is that a lot of those patients will actually be taking less fiber, which is actually what they shouldn't be doing, because they should be really trying to supercharge their microbiome, because it's those little good bacteria that produce short chain fatty acids, and those short chain fatty acids are anti-inflammatory. So they produce a huge amount of butyrate. This is what these bacteria do. And the butyrate takes down inflammation in your gut. So it alleviates all the bloating, cramps, pains. It heals up the gut wall and takes down kind of any ulcerations or anything that you would experience, say, if you have Crohn's or colitis or other inflammatory bowel diseases as well. So the very thing that you're trying to do, if that makes sense, whenever you have IBD, is done by your good bacteria in producing all of these short chain fatty acids, but you need to feed them fiber in order for them to be able to do that. So that's why I often recommend cauliflower, because it's a soluble fiber supplement, because it won't irritate your gut or anything, Trisha, because a lot of fibers do, unfortunately, and even fibers, the lady asked just about nuts and seeds. I see a lot of patients who have Crohn's, colitis or diverticulitis, that nuts and seeds really flare it up, actually, because it can get trapped in little pockets, particularly diverticulitis patients, because that just has a little tiny pocket on your gut wall. And sometimes the seeds in the nuts get trapped in that, would you believe? And that can cause more inflammation, which can then turn into infection. So if you're a patient that has diverticulitis, and you only really know by getting a scope done if you do have, then I would tend to stay away from those kinds of food and maybe taking a soluble fiber supplement, something that completely dissolves so it doesn't have little bits in it, is a much more appropriate thing for you to do. So Celliflor is brilliant at doing that because it will help with your bowel motility, it will feed your bacteria in Symprove and also in your gut, and you will see, I suppose, your symptoms improve so much quicker.
And you have that on the website, so my code will work on that.
Absolutely, yeah, absolutely. It's called SYLLIFLOR. So if there's anybody here on the line who's already tried Symprove, but they're kind of like, oh, I see all the reviews, because we have about 3,000 reviews on our website, and they're amazing. Like, they're actually heartbreaking when you read them, but also transformative, really life-changing for so many patients. But people often contact me and say, my friend's been on it, and her symptoms started to improve after 2 weeks, and I'm on it now 6 weeks, and I'm not seeing any massive changes. 9 out of 10 times when I talk to those patients, it's because they're not having enough fiber in their diet. If you increase your fiber, you will see results so much faster. And if you're just worried about, okay, well, what fibers do I take, or I'm worried about eating those foods because it flares me up or whatever, then go for the Celliflor, because it's really, really easily tolerated. But 6 spoonfuls throughout the whole day is enough fiber for your content for the whole day. And you can use it in your baking, you can put it into soups, you can sprinkle, what I do is I sprinkle it on top of my cereal in the morning, and you mix it into yogurt. It's so easy to take. You can even take it off the spoon, or you can dissolve it in a glass of water and just drink it down, Trisha.
And will those 6 spoons give you the 30 grams of fibre or 50?
30.
Okay.
Because
And then you'll get the rest of it from your cucumber, onions, tomatoes, raspberries, all the lovely micronutrients. That is so, I love that. I'm actually going to start taking that because I don't think I'm getting enough fibre. I'm trying, but I keep forgetting.
There was a study done, I'd say it was actually a UK study, it wasn't an Irish study, done last year, and something like 78% of people are not eating enough fibre, and especially our children. Children, they eat white food, white bread, white pasta, everything's very bland. They're just not taking enough fibre. And we see so much constipation in young kids, particularly constipation in children who've been on multiple antibiotics, because antibiotics knock out your good bacteria in your gut. And so after every antibiotic, it takes 1 year for your gut to come back, your microbiome to come back. So we particularly see it with children who are on maybe antibiotics all the time, or maybe taking antibiotics, for their skin, maybe adolescents, they might be on an antibiotic for, and we see the flare up of acne as a result of that, So definitely, if you're on an antibiotic, 100%, you need to really consider taking something like Symprove. And if you increase the fiber intake naturally, great, but if you can't, Celliflor is a great way to do it. And also, Trisha, I would say for anybody who's on a PPI, so that's a protein pump inhibitor, so anything like Nexium, Pantium, Losec, anything that is for acid reflux, definitely 100% consider taking Symprove, because how those drugs work, they stop acid production in your stomach, as you know, right? So you don't have the reflux. But actually, by doing that, more bacteria that you might be taking off your food that would naturally be killed by that acid in your stomach get through the stomach and into the small intestine. And that's why we see a lot of patients who are on PPIs also have SIBO, this small intestinal overgrowth of bacteria. So that just means you end up getting more bad bacteria through and into your gut. And so you really should look at optimizing your gut microbiome by taking something like Symprove, because yes, the PPI is sorting out your reflux, but actually by taking a PPI, you have less acid, and don't forget your stomach is there to break down food, but is actually there to protect you. So that acid is stopping bad bacteria getting into your system and into your small intestine, so that it basically doesn't get into your circulation. But if you're reducing that acid content in your stomach, more get through the stomach and into the small intestine. And that's why we see this correlation between PPI and SIBO. Yeah, 100%. So if you're on a PPI, anything to reduce acid in your stomach, honestly, you should really, really, really consider this, because there's a huge correlation between that. And we often see SIBO patients also having flare-ups in their skin. Some patients, it comes out as rosacea, others eczema somewhere in their skin, others it can be an acne flare-up, So usually we see a correlation between those three things.
Well, I think that, like, I think it's one of those things for me, it sets up a routine and it sets up that I'm looking after my gut in the morning, first thing out the gap. And I know that, example, on the 25% off, I've ordered mum and dad's 12 months of each. So it's not something that I suppose I often wonder when people are like, oh, she's only saying that now. But I ordered this for mum and dad
Yeah.
because not only all of the benefits with inflammation, mammoth arthritis, dry scalp, all this kind of stuff. What I love is the serotonin. And I don't think in any stretch we're saying that this is a cure if your mental health isn't great.
Yeah.
But I love the fact of, will you go through the serotonin and why this
Yes.
could be
Sure.
beneficial to your
Yeah.
mental health?
Oh, yeah, yeah. So basically, we know that there's a massive correlation between your gut health and your mental health. And the reason for that is your gut and your brain are connected by the vagus nerve. So we have 12 cranial nerves in our body. 11 of them come to our shoulders. So one for our sight, one for our hearing, one for our taste. So 11 come to our shoulders. And then the biggest one in our body is called our vagus nerve. And it attaches from your brain down to your gut. And it's like a big trunk of a tree, if you imagine, Trisha. And then from that, loads of branches go out to other organs in your body. So for example, to your kidneys, to your liver, to your reproductive system. So basically that vagus nerve is the biggest nerve in our body. And your gut is called your second brain because it has loads of neurons. There's up to 500 million neurons in your gut, believe it or not.
Is
So
that why
that's
they
why,
say trust your gut?
yeah, and they call your gut your second brain because it has this intuition because it has all these neurons. Like we have something like 87 million neurons in our brain, so loads of neurons in our brain, but we have 500 million neurons in our gut. So our gut actually is your intuition. So that's why exactly that they say trust your gut. It knows and it senses, whether something is right or wrong, But also the big thing about it that I don't think people really understand is that these little these good bacteria in your gut, your microbiome, the good guys as we call them, and don't forget, we have more bacteria in us than we have human cells in our body. There's
Yeah.
37 trillion bacteria in you, and there's 30 trillion human cells. So there's actually more bacteria in you than actually human cells. And in fact, if you take red blood cells out of the equation, because they don't have a nucleus and they don't have any DNA as a result of that, we're actually over 90% bacteria and 10% human cells. So that's kind of like mind-blowing. So to think that these bacteria don't do something would be very naive of us. So what do? Well, they make, as I said, short chain fatty acids, which play a really important role in healing the gut and also healing the rest of our body. So butyrate, acetate, propionate, all of the rest. Okay, so these are all made in the gut. They make B vitamins, so for energy. That's why a lot of people will say they feel a lot more energy when they're taking Symprove. They make vitamin K for clotting, but they also make neurotransmitters, Trisha. So neurotransmitters that we always thought were made in the brain, and serotonin is one of them. They also make melatonin for your sleep. They make dopamine for your mood and enhancing, but actually 95% of our serotonin, which is our happy hormone, is made by our gut bacteria. And the reason for that, the scientists think that that's why that is because serotonin is not only just our happy hormone that improves our mood and reduces anxiety, but serotonin also plays a huge role in gut motility. So it actually tells our gut cells, whether to relax or contract to move things along our body. So really serotonin is made here. So we know that if you improve your microbiome, as a result of that, you're going to have elevated levels of serotonin. And serotonin is exactly what most antidepressants are, serotonin uptake inhibitors. That's SSRIs.
Yeah.
You'll hear that class. So these drugs work by stopping the uptake of serotonin in our brain so that you have more serotonin floating around in your brain. So therefore you have an elevated mood. But the serotonin is made naturally in your gut. Would you believe?
Wow.
And there was a huge study done, a SMILE study. I don't know if you've heard of it, Trish, but basically it is a study that researched actually patients who had depression, if they went on an anti-inflammatory diet, lots of omegas, lots of whole foods and fruit and vegetables. So a real anti-inflammatory diet to feed the gut bacteria, and also those omegas to reduce inflammation in our brain. What happened versus patients who actually were on serotonin and SSRIs, antidepressants, drugs, and actually the results were that the patients who looked at it through their diet was actually much more enhanced. So we often recommend you know, in our business in Mars, if you are on anything for depression or anxiety, or if you have ADHD or ASD as well, Trisha, because these are all inflammation of these all exasperate the symptoms of ADHD, any kind of neurodiversity at all these symptoms are exasperated through inflammation. So what you're trying to do is reduce inflammation. And if you can reduce inflammation in the gut by producing all these short chain fatty acids that take inflammation down, not only will you take the inflammation down, which takes inflammation down in your brain as a result, because the two things are connected, because it travels the vagus nerve, these little these molecules, these chemicals travel the vagus nerve, so it takes the inflammation down in your brain as well as your gut. But also you will feed the bacteria to produce the serotonin, and the serotonin elevates your mood and reduces anxiety.
It's insane how it's all connected. Like you see the comments going through. So many lovely comments. This lady has shared. Love Symprove, saved me after being so unwell last year. Next one, unbelievable product. And that's the thing. Those 3,000 reviews you have online have to be verified users. They putting up pictures. It's their names. Like it's one of those. I think it's one of those desert island products. But the lady just asked a question there. She's waiting on a kidney transplant, and she said she's on ESPKD, all capital letters. Is it okay to take it with this?
It absolutely is. Absolutely. I think somebody asked about statins as well. It absolutely is. And it's really fascinating as well. We are actually running an event on Wednesday night, Trisha. And we have 3 professors coming from the APC Centre in Cork. Amazing centre down in Cork. It's one of the global, you know, I think that we don't even know what's going on in our country sometimes. So this centre, the APC Centre, is one of the global research centres into the microbiome. That's all they do, study the microbiome, these little bacteria down there. And what do they do? And there's so many clinical studies going on down there to see actually how does your microbiome influence your mental health. So Professor John Cryan did an amazing Netflix documentary. There was an amazing Netflix documentary. He participated in it. About his research, he's actually written a fantastic book about psychobiotics. So bacteria that have a psychological impact, you know. So he's written a fantastic book about it. People should read it. If you do have issues with your mental health, read that book because it's absolutely fascinating. So he is like one of the global experts here in Cork. And so we have 3 professors coming on Wednesday night to talk about their research. We have one lady, Siobhan O'Mahony, who worked with John on the mental health work that he did, but has now gone on to work on the impact of your microbiome on female hormone health. So she specializes really in perimenopause and menopause, but basically she has discovered that there's 10 bacteria in your gut called your estrogen whenever we put them all together. And if you're lacking in those, then you are going to see effects on your female hormone health. So basically these bacteria to almost regurgitate your estrogen and progesterone and send it back into your system. It kind of sort of like cleans it up, if you want to say, and puts it back and recycles it and puts it back into your system. But if you're lacking any of those bacteria, then you're going to see an exacerbation, say, of perimenopause and menopause symptoms, or it may affect you if you're in your fertile years and you have PMS symptoms or PMDD or PCOS or endometriosis. This is all linked back, believe it or not, to inflammation and a lack of these bacteria in your gut. The second thing, unbelievable. She's absolutely doing a fantastic body of study there, and she's going to want my mum's phone because my phone was dead. And then the second thing that the other person that we have coming is a lady who's talking about her research in terms of the gut microbiome and skin health. So that's all her research into acne, rosacea, eczema, dermatitis, and how if you optimize your microbiome, how that all improves. So that's what she's talking about. And the third guy, Jan Walter is his name. He's actually studied, I think it was in Patagonia, a tribe of people who basically eat a certain diet and how they do not have high blood pressure, they do not have obesity in their community, high blood sugars, they do not have diabetes, and they don't have any obesity. So basically he studied that diet and the effects on the microbiome as a result of that, and how that actually impacts your metabolic health. So if you can adjust your microbiome, you can reduce your blood pressure, reduce your cholesterol, you can reduce your blood sugars. So anybody who has heart conditions or cardiovascular conditions or diabetes or obesity in any shape, this all is connected to your microbiome, would you believe, Trisha? Like these little bacteria that they have now discovered are the bacteria send little messages to these cells on your gut lining, which make GLP-1, you know, this hormone that all these drugs, so Ozempic and Mounjaro and everything is actually linked to. So adjusting your microbiome is really important to your weight management as well. So, and he's going to be talking about his study all around that and what he's discovered in that. So if you like, and he said like within 10 days on using this diet, you can start to see changes to your microbiome. So if you couple something like that, a changed diet and eating the way that we're supposed to eat with something like Symprove, like, I mean, it's life changing. It really is life changing. And then if you add in the fiber, because then you're feeding them properly, then again, life changing. But the one thing I will say on all of that, Trisha, is you will feed the bad bacteria if you eat ultra processed foods or sugar, right? Because that's what the bad bacteria love. And as a result, they produce bad metabolites that cause inflammation in your gut, that seep out and cause inflammation elsewhere in your body. So you just have to think about, actually, when you're eating and look at your plate, what am I feeding myself, first of all? But actually, which bacteria am I feeding? Am I feeding the good guys? Yeah, what they want? Lots of fiber, lots of color, lots of polyphenols, lots of omegas, or is what's on this plate feeding the bad bacteria? Because if I'm feeding the bad bacteria, what's going to happen is I'm going to be producing all these bad metabolites that produce inflammation in the gut, which cause inflammation elsewhere in the body. So feed the good guys and you will see the benefits. Feed the bad guys and you will see inflammation elsewhere.
Yeah. So John, Siobhan and Jen, so that's Wednesday night. Where's it on? Please say Cork.
Smock Alley. No, it's not in Cork. It's in Dublin, unfortunately. Sorry. But any of your Dublin followers,
Is there any tickets left?
I'd love to see you. Yeah, tickets are 25 quid. You get a goodie bag worth 50. You get food and drink. But the main thing that you get to hear these global, like they are global experts. There's 2 panels, 3 from the APC Centre. Then we have a consultant gastroenterologist speaking on a panel along with myself and Amy from Colitis Crohn's Ireland. So if you're colitis or Crohn's or IBD, you know, she can speak about that. The consultant is going to be speaking about IBS and other gastric issues and how adjusting the microbiome can really impact that. I'll talk about whatever Claire wants to ask me about. I don't know what she's going to ask me about, but I'll talk about
my Claire hosting it?
Yeah. And Claire McKenna is doing the MC. Yeah. So it'll be amazing. And if anybody is a bit of a nerd around this or has an interest in this, I would highly encourage you to come. Send me a DM. I'll put up the link, or I'll send you the link to the tickets afterwards, Trisha, if you want to share it. It's going to be phenomenal because I have never seen as many experts in one room on the gut microbiome ever in my life.
Wow.
And that's why we've focused on getting the best of the best in Ireland together.
What time is that on Wednesday night?
7 to 9 p.m. in Smock Alley.
So €25, you get a €50 goodie bag, food and drink, and a wealth of knowledge.
Wealth of knowledge. You'll
be like 5 Oonaghs.
With your mind blowing. It'll be the best 2 hours of your life. It'll set you up in terms of preventative care. If you've got a chronic illness, if you've got diabetes, if you've got cardiovascular problems, if you've got mental health, you will come away kind of going, oh my God, now I know what to do. Or if you're worried about developing any of those, or somebody in your family has those, you will come away going, it'll be like putting on a pair of glasses and seeing for the first time. I
can't imagine all the nerds on the microbiome,
all the nerds.
Which is you multiplying. I'd be like, I'll be fab. If you can send me the link afterwards, and if anyone wants the link, DM me straight away. Even Fiona has put up a lovely, amazing product on a 6 months now. Such a difference. It's a lifesaver. Like, it's just, they're flying in. The next thing.
I will say though, Trisha, if you are going to invest in it, it is an amazing chance to try because you get 50 quid off the 12-week program.
And I worked this out. It's only €1.66 per day to do all of that magic. So even if you're a non-believer and you don't even think twice about a $4.50 matcha latte, think about what you could be doing for your gut and all the benefits. So with this offer, it's only €1.66. Kind of nothing really to lose by chancing it and doing it right.
Yeah, I think, listen, because you know what I hear all the time, Trisha? People say to me, oh, I didn't think I had any gut problems because I thought that this was normal, that they were living with. Yeah. But then they take Symprove, and after 12 weeks, they kind of go, that wasn't normal at all. I was living. I had no idea. I sort of thought that was normal. Because you get used to like living the way, and you get used to saying, oh, after certain foods, I just bloat. That's just the way it is. Or I just have a dicky tummy, or I just have a bit of reflux, or I just have... And people get used to that. That becomes their norm. And
Yeah.
so as a result of that, they kind of think no different until they go through this. But what I would say is be committed, do the 12 weeks, because we know it takes up to 12 weeks for your microbiome to be rebalanced. But you'll see in all those reviews, most people see a difference after 4 to 6 weeks. But definitely do the 12 weeks, because when you buy 2 boxes of Symprove, which is 8 weeks, you get the other 4 weeks for free. So like literally, that's a box and it has 4 weeks in it. But when you buy 2 of them, you already get another box for free. So like, commit to doing that. Or if you don't want to do that and you've never tried it before, even buy the 4-week box, get another 4 weeks at another stage. You've got 2 receipts, you can still claim the free pack back. You know what I mean? Like, so even if you don't want to commit for the whole 12 weeks, even do the 4 weeks, but try and then get the other 4 weeks at another stage afterwards, because you'll still are entitled to that 4 free weeks, if that makes sense. But do 2 things. Be committed. Number 1, do it first thing in the morning, every morning. Do your 70 mils and don't eat or drink anything other than water for 10 minutes, because then you know all the bacteria have got to the large intestine. That's number 1. And number 2, to see the best benefits, increase your fiber, because you've got to feed the little guys what they're looking for so that they can grow and thrive really quickly, so that you can see the results really quickly. And I promise you, if you do that within 4 weeks, you will notice a massive difference. Yeah. And by the time you get to 12 weeks, you will be you'll be looking even different. People will say to you, your skin's glowing. Like, look at your skin, it's glowing. I'm sure you have a ring light, but it's still glowing. Like you were, last time I seen you, I couldn't believe you. Your skin was like glass. It was amazing.
Thank you.
So yeah, honestly, anybody who's on it, you kind of know. I meet people now and I go, you're on Symprove, aren't you? I just know by the look of them. And I know by their energy even, you know?
Yeah.
That's amazing.
And what I think is, just so people to know, because some people are worried, it is vegan friendly, it is gluten free. So it can be a family thing as well, because, you know, you don't have to have only one person on it, but just when you're taking it, it's so important. Once it's open, it has to stay in the fridge, because otherwise the bacteria will die. And the other thing is, before, you could just order 8 weeks, and then you just apply for the other 4 weeks. That's all gone now. The shelf life date is a little bit longer, so you'll get your 12 weeks. Like this Trisha, this Mike, it's fabulous stuff. This is a game changer. It's insane. Someone wants to know, can she take it when she's fasting? And the other question, before I forget, comes in loads. Endometriosis. Is there any research on this or anything? Because there was a couple of people, maybe it's my age range is happening now that's getting more diagnosed, but that's been asked to me privately. I've sent you the screenshots, but I'm just going to say it here in case somebody doesn't want to ask.
Okay. Well, first of all, what was your first question? Is it?
Can you take it when you're fasting?
Yes.
So just say,
Okay.
if you've asked for an appointment, you're fasting in the morning, because it's water-based, you can, can't you?
You can, but what I would do is I just wait until 10 minutes before you break your fast. So don't take it first thing in the morning. So say you're not going to eat and your fast is going to be broken at 12 o'clock, say. Just take it 10 minutes before your fast is broken. Yeah.
Okay.
So it should be fine, because it's like 99% water and just the bacteria. But I know some people say to me, oh, are you sure? Are you sure? And I think, to be honest with you, when it's playing around in your mind like that, it's better just to wait to the 10 minutes before you break your fast. Because the only reason you take it first thing in the morning like that is because your acid levels in your stomach are really, really low. So if you're fasting right up to 12 o'clock, your acid levels are still really, really low, and it doesn't matter what time you take it, as long as you don't eat or drink anything other than water for 10 minutes afterwards. Okay, so that's the first question on the fasting. Endometriosis, they've started a study on this, Trisha. There's an amazing study about to come out on Parkinson's, which is going to be global game changer, right? And I'll explain that if you want me to explain that in a second. But they've started lots of studies. Actually, the first study done in Ireland has just been launched last week, which I actually must even post. I haven't even managed to post that yet with everything going on. So this was a study done in Tallaght University Hospital. Professor Anthony O'Connor did it, and he did it with patients who had IBS symptoms but had IBD, either Crohn's or colitis, right? Because those are the patients that are the sickest, that take up hospital beds the longest. Unfortunately, they're admitted all the time. So they either have colitis or they have Crohn's, but they present with IBS symptoms. So bloating, cramps, pains, all of that type of stuff. And so he gave half his patients Symprove, who were in this category, and half a placebo. And long story short, after the 12 weeks, significant changes in the Symprove patients. So it just shows I suppose, if you want to call the very sick patients, as in patients who would have colitis or Crohn's, who would have the worst gastrointestinal symptoms. I have IBS, but I don't have IBD. So these are patients who have ulceration in their gut, who would be bleeding from the back passage, who would have chronic diarrhea. Colitis usually affects just the lower part of the gut, the large intestine, the rectum, whereas Crohn's can appear in pockets all over. It can be from your gum, like literally right through to your bum. So these patients are, much more severe symptoms and, bleeding and inflammation and whatnot. So the patients who took Symprove seen a massive improvement in their IBS symptoms, which is amazing to see that, a product like Symprove could actually give that improvement. But in relation to your question, so there's always clinical studies going on, and there is one started on endometriosis. And the reason for this is, when you think about endometriosis, what is it? It's basically endometrial tissue that is found outside the womb. And it's very inflammatory, and it's very, very painful. And unfortunately for ladies who have it, it can take up to 8 years for a diagnosis here in Ireland, unfortunately, because basically they'll try lots of other things to rule out, and then finally they might investigate for endometriosis, yeah? And if you think about it, it is an inflammatory condition. Same as PCOS is an inflammatory condition. And think about how your gut, right, feeds every other system in your body. Whether it be, because that's where your food is broken down, your nutrients are released into your body for feeding your heart, feeding your gut, lungs, feeding your liver, feeding whatever, because otherwise we wouldn't survive if our gut wasn't working. It's the foundation of everything. So if there's inflammation, like I said before, in your gut, you will get inflammation elsewhere in your body. It just shows up elsewhere. For some people, it shows up in their pancreas and they might have diabetes. Other people, it might show up as high blood pressure and high cholesterol, so it's in their cardiovascular system. Other people, it might show up in their reproductive system, and it might show up as PCOS or endometriosis. Yeah? So if you take inflammation down in the gut, right, you will see a reduction elsewhere in inflammation in your body, without question. This is why we see, and so visual for skin, Trisha. If somebody has rosacea or eczema or acne and they take Symprove, and you can physically see it. So actually, God, the gut and the skin is clearly linked, like this professor is going to be explaining on Wednesday night. But because you can't see internally the other systems, it's very hard to know, actually, is one thing linked to the other. But we know for a fact that whenever you improve the microbiome by taking Symprove, a huge amount of butyrate is produced. And butyrate is a short chain fatty acid. And if anybody wants to Google it, it's BUTYRATE. And basically how it works is it heals up the gut wall. So for anybody who has leaky gut or any kind of ulceration in the gut, it will heal up that gut wall so that things can't get out of the gut. And if you have any ulceration or inflammation, it'll heal it as well. So, but that butyrate also gets into the circulation. It also travels around your blood vessels, because it just doesn't stay in the gut. It doesn't go to the gut wall and kind of go, oh, better not go any further. It gets into your circulation. And the scientists now would say that this is one of the main reasons, this anti-inflammatory effect from taking the likes of Symprove, that this is why people who have maybe rheumatoid arthritis, I know your own mum says that her joints are better, yeah? But also we know so many patients, and if that lady would like to look up the reviews on our website who use Symprove for endometriosis or PCOS or just really bad period pains, really bad PMS, PMDD, you can see a massive, massive improvement by actually treating your gut. Because all you're doing is you're taking inflammation down in the gut. Now, the clinical study has only started. It hasn't finished or anything. But I know there's actually a lady, I can't remember her name, I'll find her on Instagram, because she actually, all she does, both her and her daughter have endometriosis. She's a nutritionist, and she lectures all around the country on this now. And she just uses Symprove as part of her treatment. So Symprove and an anti-inflammatory diet with massive improvements. Massive improvements.
Wow.
That's all she does. And she goes around doing workshops on all of this. So I actually will find her on Instagram, and I'll send it to you, because anybody who has endometriosis, it should be worth checking out, because she is a trained nutritionist, but she can share her own experience using Symprove. So what I would say to you is, if you have inflammation anywhere in the body, anywhere, but endometriosis or PCOS, absolutely, it is absolutely 100% worth a go. What are you going to lose? You're not going to lose anything other than treating your gut, and hopefully you will reduce inflammation elsewhere. And I would say there's probably lots of people on here that probably have inflammation elsewhere, and they kind of go, gosh, I took it for my gut, but my eczema cleared up, or I took it for my gut and my psoriasis cleared up, or I took it for my gut and my joints are better, or I took it for my gut and, I have more energy, or I took it, like we hear this all the time, all the time.
Even you see it, there's a comment in that they notice it after 10 days, an immediate change. But I suppose that'll take the time, and that's why you need to do the full 12-week course. You haven't mentioned, but someone just asked again, it's for Crohn, like you've IBS, IBD, leaky gut syndrome, cellulite, Crohn's disease is a definite, because I know you've mentioned it to me a few times before.
Yeah, and actually Amy, who is the COO of Crohn's Colitis Ireland, is coming to speak on Wednesday night. So again, that organisation now would endorse Symprove. And actually, that is the patients in Anthony's study. So he was looking at his patients who had IBD, so either colitis or Crohn's, because IBD is an umbrella term for both those diseases. But the Crohn's patients were the patients who responded best.
Wow.
So, yeah. Yeah, I'll
That
actually
is
post the
insane.
study. I'll send you the copy of the study after this, Trisha, if you want to post it. And
It's
that's
not
like
even,
literally only out last week in a really good gastrointestinal journal, you know, and you can see all the results and how he processed it through. There's graphs of everything, and you know, it's very technical, but go to the conclusion and you'll see like basically what the conclusion says.
like, I'm not surprised, even in 8 years, I'm on it 2 years, I've never looked back. Of all the things that I put on my Instagram story, the
Yeah.
feedback or the question I get the most is, I love it, when is the next quote? It's so used. Now, Maura's here, she wants to know about fibromyalgia. Does that help? I can vouch for that with my mother, definitely. But if you can explain, because that's inflammation of the joints again, it's all about calming things down.
It just calms everything. Like if you just think of your gut, like whenever I was in college, Trisha, I was just talking to, because I did a thing for Claire McKenna yesterday, and there was a girl sitting on the panel with me, and she said, oh, like 10 years ago, we just thought that the gut was to break down food and expel waste. That's what we thought that the gut was about. Whereas now we now know it's got this kind of like internal pharmacy in you. You know, all these little bacteria making all these compounds to actually heal your whole body, not just your gut, but actually your entire body, to make you feel better, for your mood, for everything. This is all going on in your gut. So in relation to that question, if you just think about it, if your gut is working properly, like your body cannot function without water and food, right? So you need to drink water, you need to take food. The food needs to be broken down by your gut. Okay, so it's broken down mechanically in your mouth into little pieces, then into your stomach again, turned around with some acid and broken down, then into small intestine. You get some bile added, you get some pancreatic juice added, broken down another little bit with some enzymes. Then it gets to the large intestine, and then you have this huge explosion of good bacteria in your gut to break it down even further. If you don't have all those good bacteria in your gut, you're not going to have the best nutrients released from your food. Yeah, it's simple as that. And
It's
if
just
you
like eat for no point.
exactly. And so therefore, if you have that whole ecosystem working properly in your large intestine, you're going to get the best nutrients from your food. Like, I mean, even if you eat loads of organic food and you eat the best, but you don't have a healthy microbiome, you're not going to have optimized health. You know, so it's not even about the food that you eat, it's about actually being able to break it down and absorb it into your body. That's the role of your gut, to break it down into tiny little bits, make nano particles, so that it gets across the gut wall and into your circulation. Because your gut is just like a big tube. Like, think of it as plumbing. Yeah. And it's supposed to be, that gut wall is supposed to be intact, because it's supposed to protect you from nasties that might be in your gut that you're supposed to poo out getting into your system. But if that gut wall is not doing its job, if it's not intact, then what actually happens is, well, first of all, you cannot break down the food properly to get the good nutrients into your circulation to fuel the rest of your body. But also, if the gut wall starts to become more leaky than what it should be, because it's just like all these cells joined together with like almost, it's called little tight junctions between it. Like, think of cement and bricks in a wall. It starts to separate, Trisha, if there's inflammation in your gut. So if you eat a lot of ultra processed food, your body thinks, oh, what's this? This is not natural. So all these stabilizers and emulsifiers and additives and flavorings and synthetic things that we are consuming into our body, it kind of goes, this is not natural. Better attack this to get rid of this. It looks like it's a foreign body, you know? And what that does is, once there's any kind of attack of a system, there's inflammation. So what happens in the gut? Then your little cells start to swell and swell and swell. And suddenly then they start to separate. And now we've got a little gap. Then things that are in the gut, you're supposed to be pooing out into the toilet, get into your circulation and into your blood and travel to your blood and cause inflammation elsewhere in the body. So this is why we know if you fuel those bad bacteria in your gut, they will produce bad metabolites. that cause inflammation and cause that to happen. And also, if you don't feed the good bacteria to produce all these short chain fatty acids and the butyrate and whatnot, then that job is to start sealing up those gut lining again. Because your gut cells replace every couple of days, 2-3 days. Your whole gut is actually a new gut, if that makes sense. So they're always repairing and always cleaning. And that's why fasting, intermittent fasting, is really good, because it allows your gut a chance actually to heal up, because the little gut bacteria are not breaking down food, they're busy repairing your gut wall. Yeah? And that's why we see a good result, because they're doing all these different things at one time. Break down this food, eliminate this bad thing over here. Oh, break down this. Oh, heal the gut wall. Oh, produce all these metabolites. So they're busy little guys. And especially as we sleep, if you don't eat, after 6 o'clock, then you're giving your gut a little bit of a rest, so that the little bacteria can go, oh, well, there's no food, thanks be to Jesus for that. I can just repair the gut wall and do all these little metabolites and make sure I'm doing my thing to make sure that everybody stays healthy here.
It's so, once it's said, you're like, it makes so much sense. It really does. There's a good question that came in here, because I know that one of the smallies in my world went on Symprove because they were struggling with whatever. And you had said, just find out what weight the kid is roughly. And then if it's 10 kilos, give it 10 ml. But someone has just said there, does Symprove work for constipation? How early can be started? There's small newborns are put on PPIs for reflux and laxatives for constipation. Can they take Symprove instead?
Oh, yeah. No, it would not come off any medicines that have been prescribed, whether you're an adult or a child, without talking to your doctor. That's the first thing to say. But yes, absolutely, we have so many children who use this product instead of the Movicol. Movicol seems to be the thing we're dishing out so much now, to be honest with you, in pharmacy. And why are we doing that? Because our kids are not eating what they should be eating. Simple as. Or they don't have a really healthy microbiome in order to be able to break down food, and as a result they end up getting constipated. Or they may have a gut disorder that actually causes slower gut motility, that's the movement of food along the gut, and as a result they become constipated. So let's just think about the food bit. You can control that. That's the first thing. So increasing lots of fibre, lots of food, colours on their plate, lots of diversity will help to feed the good bacteria.
I think this one's based on a newborn.
Newborns, the first thing I'll say about newborns, number one is if your baby is born by C-section, that is going to make a difference to their microbiome than born vaginally. So that's the first thing to say. And why is that? When you are born vaginally and the baby comes down the vaginal canal, the baby before it is born takes a gulp of the mum's mucosa that lines the vagina, and that becomes their microbiome. Okay, so they take a gulp of that in and swallow that, and that becomes their microbiome. Okay, so for any C-section born babies, remember that the baby is lifted out, it doesn't come down the vaginal canal, so the baby is lifted out of the tummy, yeah, and it's a very sterile environment, and rightly so there's no infection, yeah. But as a result, the baby doesn't have an opportunity to take that, suck of the mucosa, and as a result, they don't have that microbiome established like a vaginally born baby. Okay, now they will get it. It's really important, and I don't want to be saying, "Oh my God, no, I shouldn't have a C-section." No, absolutely not. You have to have your C-section if it's unsafe for you to be, deliver vaginally. However, you need to think about how could I populate my baby's gut with those bacteria super fast. Yeah, and we do give Symprove to babies, and particularly preterm babies, because that microbiome, we now know C-section babies have much more prevalence towards asthma and allergies, developing allergies, and scientists now are believing that that's all linked to them not having the microbiome established until a little bit later in life. So you will get your microbiome. You get it from your environment. You get it from your food. You get it from, your pets. You get it from, playing in the dirt and all that type of stuff. So you will get it. You get it from your mum's breast milk as well. But then people say, oh, breast milk not as good as formula. And again, that's a mother's choice. That's completely a mother's choice what they decide to do. So the baby will pick up their microbiome, as they grow. However, what I always say, especially C-section born children, is definitely for those mums to think about how they can populate the gut of their child super fast. Symprove is absolutely safe to give to infants. So all you do there's no drug in Symprove. It's just the bacteria that should be in your gut. Yeah. And these particular bacteria that Barry chose, he chose those because they produce lactic acid. And lactic acid, when it's produced by these bacteria, feeds the other bacteria in your gut to actually make them grow and thrive as well. Okay. So that's why Symprove works super fast, because not only will it give these 4 bacteria, but it actually produces a product that feeds the other good bacteria to make them grow and fast as well. So it's almost like the little bacteria have a rucksack of food on their back, and when they get to the large intestine, they throw out all that food and go, here you go, guys, you all have a little party, I've got food for all of you too. Yeah, does that make sense? And so that's why Symprove works so fast compared to, you know, other products that we see. So, but there's no drug in this, Trisha. It's just bacteria that should already be in your gut. And same for babies, it should already be in their gut. So all you do for children, babies, adolescents, small children, whatever age, you weigh them and you give 1 ml per kilogram weight. So so if your baby is 5 kilograms, 5 mils, 10 kilograms, 10 mils, and so on and so forth. And all you do there is you sometimes it's in a little syringe, like, because it could be like a tiny little number of mils, and you just squirt it down the back of their throat and just wait for 10 minutes before you give them their first feed.
That is so fascinating. I have a question, just you were saying that. Can you have too much good bacteria? So if I'm taking this, should I stop? Should I intermittent? Or can I continue on taking it?
Yeah, no, you can continue on taking
Probably
it.
a mad question, but can you have too much?
No, you can't have too much. Because again, would you believe, I don't think a lot of people know this as well, every time you poo, yeah, if you were to take your poo and put it on a plate, yeah, half of that is fibers and toxins and bits and bobs that your gut is just trying to get rid of it. And half of it is bacteria that you're expelling from your body. So you're constantly needing to top up your bacteria, would you believe? Yeah, absolutely.
So keep on going. And then what I find, and it's probably just me, but if I go away on holidays, like we went to Bilbao for 2 days, it was very funny because 2 suitcases came bottles of Symprove between 8 girls. We had done it in the WhatsApp group. We were like, you bring one, I'll bring one. But what I find when I'm on holidays, I'll always take a double shot. Is that okay? Because I just find it gets things moving. All that lovely wine and dinner and stuff is gorgeous, but I just feel that bit extra kind of, ugh. Is that okay?
Yeah, 100%. Listen, it's safe to drink a full bottle of it, Trisha, but you wouldn't want to do that at the cost of it. And I had a customer in Baggot Street who used to drink a full bottle of it because he was covered head to toe in eczema so bad it would be flaking. He would be on that emulsifying ointment and actually have to use bandages. It was so bad. So he had heard about Symprove and about his eczema, and because it started to clear his eczema within like a matter of days, he started drinking like a whole bottle to get the results really fast. And I served him one day, and like then he came in the next day and he got another 2 boxes. I was like, "Would you be not in 2 days ago and got those?" And he was like, then he told me what he was doing. I was like, "You don't need to do that. You really don't need to do that. It's so expensive, but it's safe to drink like loads of this. You can take 2, 3, 4 shots. Doesn't matter because it's completely safe. It's safe bacteria. However, what I would say to you is, if you're feeling like a little bit dicky in your tummy, or you know you're going on holidays like that, or you're going to eat a rich meal, or you're going out for, I don't know, a Chinese or something that you just know has always been a bit sensitive in your gut, absolutely get ahead of it. Don't wait until you're bloated the next day. Take 2 shots that morning. Yeah, absolutely. And when people often ask me as well about antibiotics. Should I take it whenever I'm on an antibiotic? Absolutely, yes, 100%. And why is that? Think of your microbiome as a full glass of water. You want it filled to the top. Every time you take an antibiotic, you're knocking it out by a bit. And then another antibiotic, you're knocking it out another bit. Another antibiotic, until after your antibiotic is finished, it's on the ground. Because your antibiotics, even though you're taking it for a chest infection or maybe a skin infection. There's so many people who use antibiotics all the time for skin infections or UTIs. Every time you take that is knocking out good bacteria in your gut as well. So what you want to do is, when you're on an antibiotic, instead of waiting until it gets to the floor, you want to be topping it up. Every time you take your antibiotic, top it up. So you're taking one and you need to take it for whatever infection you're on, but top it back up again. Top up, top up, top up. And I actually went over to London last, 6 months ago, and I must share the video that Simon did with me. He is one of the researchers that is working in University College London, and he actually did a study looking at it with antibiotics. Do you wait until after the antibiotics, or do you take it when at the same time as taking the antibiotics, and how often? And basically what he said is, if you're on antibiotics 3 times a day, you take Symprove 3 times a day. If you're on antibiotics twice a day, you take it twice a day, or you take a double shot in the morning because you want to top it up. Now people say to me, well, I thought I was supposed to take an empty stomach or whatever. It's safe to take Symprove if you haven't eaten for 2 hours. Your stomach acid is really at low levels. So if you're on an antibiotic and you're taking it 3 times a day, say your antibiotic, wait, take your first one as you normally would do, take your second one, but don't eat for 2 hours, then take your shot of Symprove, then take your antibiotic, wait 10 minutes, and then eat your food. And then the same in the evening time. So basically what you're doing there is you're ensuring that your shot of Symprove, the 10 billion, are getting through your stomach into your gut, and they are topping up the good bacteria that your antibiotic's killing. Because your antibiotic might be killing your chest infection, the bacteria in your chest infection, but they're also killing your good guys, because they don't know what's a good bacteria and what's a bad bacteria. They just kill every bacteria. Do you know what I mean?
So then, let's say example, like sometimes I've had to take medication where you have to take it first thing in the morning and before anything. What do I take first, my probiotic or my antibiotic?
Symprove. You always take Symprove first, because even the smallest of tablet, Trisha, would you believe, sets your stomach off producing acid. Even those tiny little L-troxin tablets people take for their thyroid, they set your stomach off producing acid. Because you see, your stomach, actually, even when you are cooking food, they've proven this, it's called the Pavlov's theory. Somebody, I don't know, Dr. Pavlov, I don't know why he did this, but I know he did research to see actually what stimulates acid production in your stomach. The food does, drinking or eating anything than water does, but even cooking, and I think it was bacon or sausages he was frying, I can't remember what it was, but them actually cooking gets your brain to think, oh, I'm going to eat something soon, and that sends a message to your stomach to produce acid, would you believe? So actually you just cooking food gets your stomach to produce acid. Is that bad?
And the other question was, someone said, try to imagine when doctors prescribe antibiotics without prescribing a probiotic. Do you think it is, like, even just like, how important is it
It's so important.
if you're on
So
any medication to take it? Because it's a year for your microbiome to rebalance.
In some countries, Trisha, in the world, they are not allowed to prescribe, it's illegal to prescribe an antibiotic without a probiotic. So I think in Poland, a couple of European countries, you have to prescribe a probiotic with an antibiotic. Because what actually happens is, when there's an overuse of antibiotics in the community, you get antibiotic resistance. And as a result of that, then certain antibiotics don't work. And then they have to use another one, and then another one, or whatever. And then they're slowly running out of antibiotics that actually are effective against certain diseases, until you get to the stage where you're using something in the hospital as a hospital grade antibiotic. So we have a huge problem with antibiotic resistance now in the world as a result of this. So I know lots of patients go to the doctor and they're not feeling well, and they kind of go, oh, I just want a prescription for an antibiotic. But very often it's a virus that's causing it. And I'm sorry, but an antibiotic will not kill a virus. You know, they just don't work in viruses. But you kind of feel like, well, I paid the doctor 60 quid or whatever it is. I want something, yeah? And so they feel a bit disappointed if they don't come away with a prescription for an antibiotic. But trust me, do not take an antibiotic unless you need it. Please don't do that, because
It's probably a mad question.
Yeah.
Is it as simple as taking, just say, 7 months ago, I had a small bit of a chest infection, they gave me a steroid. That will knock my microbiome out for a year.
Absolutely.
Like a 7-day course.
Yeah. Well, antibiotics, yeah, if you're prescribed an antibiotic, it will take you 1 year to get your microbiome back to what it should be. And that's as long as you're eating healthy. Like, I mean, that's as long as you're feeding the bacteria that are still left there, the food substances, those whole foods and fibers, so that they can grow and thrive, because they're on the floor. And what you need to do now is feed those little guys. And once you feed them, you know, bacteria are very selfish. What they do is they eat their food, and then they reproduce, and then they reproduce again, and then they divide and reproduce and reproduce. But it takes a full year for that to happen after one course of antibiotics. So if you're on super strong antibiotics, or say you've been in hospital and you've been on an IV drip, that's like wipeout.
Right.
And it's not just antibiotics, like Trisha, as I said, those PPIs have an effect on your microbiome because they let in the bad bacteria. And also anti-inflammatories like ibuprofen. How many people buy ibuprofen every day over the counter? That has a really negative effect on your gut lining. So sometimes we take these medicines, but like all medicines have side effects, yeah? And some of the most common medicines, unfortunately, affect our gut. Do you know? And like, here's another thing that I've been talking about recently on my own channel is, you know, we take lots of fruit and vegetables every day, and I'm always talking about increase your fiber, increase
Yeah,
the
I'm
amount
loving
of
this.
plants that you're, yeah, increase the amount of plants that you take and all the rest, right? And that is amazing, and we should be doing that. But like, we have so many plants and fruits, unfortunately, and vegetables that we spray with so many chemicals like organophosphates and pyrethroids and pesticides, insecticides, and all herbicides to keep them fresh. Because as soon as you pick them, you cut off their source of water and they start to rot, they start to putrefy. So what do farmers do? They spray them with insecticides to keep the insects from eating them in the first place whenever they're growing, but also with, you know, other chemicals, synthetic chemicals that are sprayed on them, and we take them from the supermarket and they look like they've traveled from Brazil or South America, the bananas or the whatever, the pineapples, and we think, oh God, they look great, whatever, and they're only such and such a value. They've traveled halfway across the world. It doesn't make sense. How could they still stay fresh? So they are sprayed, laced with chemicals. And unless you wash them and get those chemicals off, you are taking additives, chemicals into your body that is going to cause inflammation in your gut lining. 100%. And that inflammation will cause inflammation elsewhere in your body. So this is why we see so many, I suppose, this huge increase in autoimmune diseases and all lots of other diseases like this. Like, inflammation is at the core of all chronic illnesses, whether it be diabetes, whether it be cardiovascular, whether it be all types of cancers, whether it be autoimmune diseases. It's all linked to inflammation, and that inflammation starts in your body and starts definitely in your gut. So my whole thing recently that I've been sharing on my own channel is we have these 12 fruit and vegetables that we call the dirty dozen. They're the ones that this list changes every year, Trisha. So they're the ones that have got the most insecticides and the most herbicides and the most organic phosphates on it, because they rot the quickest. And unfortunately, like, things like strawberries are top of the list. Top of the list. And how many people take a punnet of strawberries, don't wash them, and eat them straight from the punnet? Yeah. And that is just covered, unfortunately, unless they're organic. Yeah. Definitely, they're laced with all sorts of, you know, pesticides. And blueberries, my favorite. I don't know how many times in the past that I've eaten them out of the punnet. An apple a day keeps the doctor away. Well, not if it's covered in pesticides, you know. So you need to wash your fruit and vegetables. That's the first thing. And cold running water. But better still, the best hack that I have is use a little bit of bicarbonate of soda, put it into a glass or ceramic jar, bowl, put cold water in, and put your fruit in. Now, don't go swishing it around and ruining it. Just dab it gently under the water, take it out, pat it dry with a clean tea towel or with a bit of kitchen roll, and you will take the pesticides. You will neutralize the pesticides off it. And then you haven't got those on it. When you consume them, you don't have this inflammation in your body. Your body is not kind of going, oh, what is that dangerous chemical? It's just going, yummy, yummy, yummy. That's loads of good polyphenols that I love. So
That is fascinating. And also watching you talk on something you're so passionate about is class. I learned so much there. Like, it's a simple thing, but I would often, if I'm on the go, get a punnet of blueberries and eat them away happy out, but you just don't think. So even if you're on the go, just rinse it with a bit of water from your water bottle. And
yeah,
I'm a fecker first. I will eat it from the packet. I love it. Would that be the same then with like a bag of rockers, bag of iceberg lettuce? Are people, you know, when we're buying convenience, should we just do one extra step? There is nothing wrong with having pre-prep stuff. Just do
no,
an extra step.
absolutely. Just do your extra step. Run it under cold water. There's 12. I've shared it in a video. If you want, I'll send you the link to the video, Trisha, if you want to share it. The 12 dirty dozen for last year is in that. So apples, pears,
I seen
nectarines.
on your story this morning.
Yeah, apples, pears, nectarines, cherries, blueberries, strawberries, spinach, kale, green beans. I'm missing one. Peppers. So that's the 12 dirty dozen this year. It will change because they analyze this each year and they test like fruit and vegetables, and then they decide, okay, which are the 12 worst, and they're called the dirty dozen. And then they have what is known as a clean 15. The 15 fruit and vegetables that have the least amount of pesticides, etc. on. So if you have an autoimmune disorder, or you have a lot of inflammation, or God forbid you have, you know, cancer of any type, or rheumatoid arthritis, or any kind of inflammation in your body, IBD, cardiovascular problems, then try and stay away from the dirty dozen and eat more clean 15. But the number one thing to do is to wash your fruit and vegetables. It doesn't matter where they come from, really. If it's clean 15, or just wash them under cold water and pat them dry. Or the best thing to do is to use a little bit of bicarbonated soda that will neutralize the majority of these chemicals before you consume them. Yeah. And the other thing I would say, Trisha, is something just give, buy organic. Organic they might use natural, but they're not using synthetic herbicides and pesticides and all of the rest. They're using organic methods of farming, so you're not going to have that inflammation. Also, I would say buy local, buy Irish, because then you're not buying fruit and vegetables that have traveled from South America across the world, because think about it, something has been sprayed on that to keep it fresh before it gets to you. And buy in season. There is a reason why we should be eating in season, because otherwise, if you're eating something that's out of season, then something has happened to make it come, grow out of season, if that makes sense. So there's been something added to the ground or whatever, or to it to make it actually grow out of season. So buy Irish. You're not only supporting the Irish economy, your Irish local farmers, your Irish community, because they're going to need people to work on the farm. So but you're also supporting your health and the health of your children and your family as well. So buy local, buy Irish, buy in season, buy organic if you can. And I know it's a little bit more expensive, I know it is, but God almighty, the difference in that, when you think about what it's doing to your health, it's, I'm sorry, I'd rather do that than spend, your $4.50 on your cafe latte or whatever the hell that we have no thought of actually spending money on,
So what we should do? We should do a live on the Dirty Dozen and the Clean 15 and do a recipe. Wouldn't that be good crack?
Exactly. And it's really, people think it's
Like,
complicated. It's not complicated, Trish. And you're a whiz in terms of cooking up quick recipes that we know this is the healthy stuff that we should be consuming or whatever. Absolutely, let's do that. We should do it together in your kitchen.
I'd love that. Hello.
Absolutely. And just on that food bit, just be so careful about what you're consuming. Look at the back of the packets. I know Sophie Morris is doing great work on this in terms of highlighting ingredients and things. But if you don't recognize those ingredients in the back of your packages, they are unnatural. If you don't find them in your cupboard, you are consuming something that's unnatural. It is generally synthetic. It's usually made for the petroleum industry, not for the food industry. And you're taking it into your body, and your body is going, this is not natural, and it is going to attack it, and it causes inflammation. So look at the back of the packets and look for hidden sugars, because those sugars, and I'm not talking about granulated sugar or sugary donut or anything like that. I'm talking about things that they put in, the food companies put into our food to make them tastier and more appealing. And this is like where low-fat products drive me absolutely crazy, or low-fat sodas like diet sodas are worse, because what they do is they put something in to make that appealing. So they take the fat out, but they put sugar in so it's palatable and so that it's tasty. And that sugar feeds the bad bacteria in your gut, which cause that inflammation. Or they'll put in an additive to make it much more appealing so that you eat more of it. And as a result, those additives cause inflammation in our body, which cause inflammation elsewhere in our body. So just be so careful about what you're consuming. It's the same. The worst is actually the diet sodas, Diet Coke, shouldn't probably mention brands, but diet anything. That product has aspartame in it. Aspartame is a known carcinogen. Do you know what I mean? So we think, oh God, we're taking the diet when there's not much sugar in that or whatever, I'm doing good. No, there's other things in it that actually cause this inflammation in our body, which actually, as a result of that, cause inflammation elsewhere in the body, and that is a root cause of all illnesses, inflammation. We have to try and reduce inflammation in our body.
I have a question then. Let's say we're on about diet soda or whatever it is. You scared me there when you said you shouldn't say the brand. I was like, who's watching? But what about one every so often? I used to kind of, when I started this weight loss journey, I was like, I'll have a can of diet soda in the evening with my dinner. It'll be like a treat. It's 0 calories. But then after a while, I was like, I just don't feel great from it. My tummy was kind of a bit sore. And now if I go out maybe for a dinner, I might, instead of a glass of wine, I'll get a Coke there. Is very little okay? Or would you be the type of person that's like, no?
Well, listen, I'm not going to say no, Trisha, because we have to live. And, if we were to stay away from absolutely everything, we wouldn't live I'm not trying to scare anybody here. I'm just trying to say, just be conscious and be aware of what you're consuming into your body, because you have that choice. Do you know what I mean? Like, you have a choice of, if you consume things that cause inflammation, you're setting your body up. It might not happen today, but if you're constantly at it, it's compounding, and some point in the future, you will end up with inflammation will present as whether it be diabetes or cardiovascular problems or whatever. So of course we all need a treat. I eat things on the go. I sometimes forget to wash my berries too. I absolutely sometimes have a diet soda as well. I absolutely would have a pizza on a Friday night. I absolutely would have the odd Chinese. Things that I know actually are not good for me. We all have to have a bit of balance. Like, let's be realistic about it. But even, I think, if you think about your day, Trisha, and you normally have 3 meals a day, even if you get one of those meals right, then you have a third of a chance that things are improved in your body. If you get 2 meals right, then you have 2/3. You're making a change for 60% of the time. So we're not perfect, Trisha. I'm not perfect, right? And I'm not trying to preach or anything like that or scare anybody. But you just have to be conscious of what we eat and what we drink. Because, you know, Steve Jobs said it, Trisha, on his deathbed. The man shouldn't have died at the age that he died. What a waste of a life. He had pancreatic cancer, and his dying words pretty much a couple of weeks before he died said, let food be your medicine, because if you don't, someday medicine will become your food.
It's mad, isn't it? And that's why I love the message that you have since the very first day I met you 6, 7 years ago, that you're a 360 pharmacy. It's not just here's medication, away you go. That there's so many other ways where you can enhance your lifestyle, elevate your health, push yourself to and go more natural and holistic. That you're not all about, yes, I know we're on about a life, but simple about products. But if
Yes.
someone does not buy it from this live tonight, they're going to
Yep.
go away with 3 or 4 other pieces of information they can implement tomorrow. Which is
Yep.
why I do find following your page, following Mars, it's a little reminder sometimes that we can do other things
Oh,
and go
absolutely.
for the low hanging, washed fruit, is what I would say.
Washed and dipped in sodium bicarbonate
Yes,
fruit and
I have a couple
pasteurized
of
milk to wake it
questions.
up.
And I'm so sorry, I told you it'd be max 45 minutes. I'm so sorry.
It's okay.
But it'll be fine. I
We can.
just love it. I could sit here for the day with you and be like, instead of a glass of wine, I'll have a glass of Symprove.
Well, there you go. There you are.
Amy wants to know, is it true that if you have a teaspoon of bicarbonate soda in the water first thing in the morning and burp, this sounds like a bit like a Reddit forum, you have low stomach acid?
Well, you see, what that does, it neutralizes stomach acid. You know, well, it neutralizes kind of any acid. And that's why when you dissolve it in, it's actually alkaline, so it will neutralize anything that's acidic. So absolutely, if you take it, and this is why it's sometimes included in certain medicines, it will neutralize acid. All we're trying to do here is we're trying to neutralize the acidic chemicals that would be on your fruit in order to take, I suppose, the acidity out of them. It's not going to remove them all completely. You know what I mean? Like, it's not going to be like, oh, there's all the organophosphates gone, but you're doing all you can to reduce the impact of those coming into your body. The only way of actually eliminating them completely from your system is actually not having them on your fruit and veg in the first place. And that's why we say bioorganic, because you won't have those nasty chemical, synthetic insecticides, preservatives, etc., sprayed onto your fruit and vegetables. But absolutely, 100%, if you take a spoonful of that, you will have anti-acidic kind of effects. But we don't necessarily want to, like, the question is, for anybody who suffers from reflux and has too much acid, why is that the case? Because sometimes I find if you take a PPI or you take something else to neutralize that acid, the result of that is you're going to let bad bacteria in. Now, I know that you have to get rid of those unpleasant side effects that you're experiencing. But
What's
really,
reflux? Is that like
that's just,
indigestion?
it's just indigestion, which is basically excess acid produced, Trisha. So really what I would say to anybody who has that is, you know, what you have to get to the root cause of this. Why do you have the reflux in the first place? Because by taking a PPI, all you're doing is putting a sticker on top of it, like a plaster on top of a wound, if that makes sense. If you can peel it back to figure out, okay, well, why do I have excess acid? And listen, we see it all of the time. It could be people who are stressed have excess acid, because excess cortisol and adrenaline will get your stomach to produce that excess acid. So if you sort out the stress, then you won't have the excess acid, so therefore you wouldn't need a PPI. Sometimes it's people who eat a lot of fatty and spicy food, or smoking causes a lot of acid. Vaping, my God, the rise in vaping now. And we see that particularly with the teenagers. They never had this massive acidic reflux conditions. I'm sure there's lots of people on the live here whose children would say, Mum, I have a real burning sensation now. I'm like, they're probably vaping that, and this is causing the reflux. So there's something usually that sets off your stomach to produce excess acid. Your stomach doesn't wake up one morning and say, oh, I think I'll just produce more acid. Something has happened that it thinks it should produce more acid. So it can be stress. It can be the way that you're alcohol intake, too much caffeine, too much coffee and tea will do it. Certain drinks will do it. Lots of acidic drinks, like as in lots of orange juice and the likes of that will do it. Stress is a massive thing, as I said. Sometimes it's fried food, really rich foods that just don't agree with you, because what all your stomach is doing is, I have to produce more acid to try and break this down, because this is like tough stuff to break down. So your stomach is responding by producing more acid because of something you're doing, if that makes sense. But if you keep on eating like the fried foods and smoking or vaping or drinking whatever alcohol, and then you take a PPI and you kind of go, oh, well, listen, this is sorting out the acid. Taking that PPI has a consequence, if that makes sense. It's letting more bad bacteria in, it's doing other things to your gut or whatever. You need to really sort out why your stomach is producing all this acid in the first place.
Yeah.
So I would always say to people, no matter what the medication is, like, it's the same with blood pressure tablets. And I'm not saying you shouldn't come up. Of course, you need to take your blood pressure tablets, but there's something driving up your blood pressure, and very often it can be lifestyle issues. So it could be stress, it could be smoking, it could be that your cholesterol is really high, it could be, something usually is attributing. Now, obviously, sometimes we have hereditary high blood pressure, but 9 out of 10 times there's a lifestyle thing going on that's actually driving it up. So I always think that you have to, it doesn't matter what the illness is, Trisha, you have to get to the root cause of it, because if you can do that, right, you can prevent these illnesses happening in the first place. And particularly people whose parents might have, my own mum and dad have cardiovascular problems, have heart disease. So I am really conscious. I don't want to get heart disease. Yeah, we have Alzheimer's in our family. I'm really conscious. I don't want to get Alzheimer's. So I'm trying to do all I can to prevent me going on that journey. So if you have a family history of something that is genetic, then you really need to be thinking about, what do I need to do stepwise to prevent getting that? And the earlier you start, Trisha, people often look at this like when they turn 50. Oh my God, 50, I better start looking after my health. The earlier you do it, you're habit stacking for the future. So if you start doing this like in your 20s or your 30s, that is like so beneficial to preventing something happening and occurring in your 50s or your 60s. And particularly if my mum or my dad has X or Y, or there's a family history of cancer, or there's a family history of this, really you should be thinking, the sooner that you start this journey and do all you can to eliminate your exposure to these chemicals, or to stop smoking or drinking in excess or whatever, or eating healthy, then you're setting yourself up to live a much healthier life. Because nobody wants
And
to
it
live
is hard.
100.
That's the thing. It is hard for someone, and I know it because I'm still going through the whole journey of trying to change from takeaways to smoking to stress to running the kitchen to constantly running on, being on, but you've never felt as low ever. That it's just, I suppose, like you said, habit stacking. The one advice I would give is start small, start slow, and make sure it's sustainable. And I think that it's really good advice, because we can be doing all this stuff in the world, but if your lifestyle isn't, I suppose, and yourself, and that's what I found the hardest part when I was at the hardest part of my life. I knew I wasn't doing things right,
Yeah.
but it's to get out of the rush.
And,
So I think
and
sometimes even go into a pharmacy, pop a DM, chat to a doctor, do something proactive this evening to say, right, I might change it up because they said something, they hit a curve. Because even as you were listening out there, I was like, we have to mind our health if we can.
Trisha, here's what I say all the time. You are in the driving seat of your health. Picture your health and the healthy life that you want to live, right? Because nobody wants to live to 100 and not be able to wipe their own bum. You want to live a long life, but you want to live a happy, healthy life as well. You want to be able to be independent. I don't want, like Cassie and Luca, wheeling me around or whatever in my 70s or 80s. I want to be able to look after their children and run around and be, you know what I mean? Like, so you want to not only live a long life, you want to live a healthy life and be active and well and be able to, you know, function properly. So the earlier you started this, the better. That's the first thing I'd say. And then you hit the nail on the head there. People then start thinking about this and get so stressed about it, you know? And it's like very overwhelming. It's scary, yeah, and it's overwhelming. It's like, oh my God, where do I start? This is why we developed that program Pharmacy 360. It's 7 different elements that you need to focus on in order to improve your health. And there's no point just focusing on one of those elements, Trisha. So one of them is nutrition, one is movement, one is sleep, one is stress management, one is your connections to other people, which
social connections are so important.
Social connection, the longest ever clinical study has been done by Harvard University, and it is looking at multi-generations, started way back in the 1940s or something, where they started studying groups of families in inner city Boston, right? And what they found over all these generations is the people who have the strongest connections in their family and their community and their friends live a longer, happier, healthier life. Connections is so important because it releases dopamine and all these feel-good hormones in our body, which have a very positive effect, not only on our mood, but actually on our health, our cardiovascular system, and our, like, all of our body systems as well. So connections is really important. This is why we know whenever we join community groups, or even whenever you're connected to your pets, Trisha, and you hug your dog or whatever, or babies or whatever, you know, this is why we know there's a release of oxytocin, the love hormone, and that then, as a result of that, reduces adrenaline and cortisol in our body or whatever, and actually has a positive effect, not only on our mental health, but actually on our physical health as well. So connections is really important. The connection you have to yourself, Trisha, is the absolute core of it all. So that is, because once you know, right, Trisha, and you'll know this yourself, why am I doing this? Is this in line with my own purpose? If you're doing something that just doesn't feel right, because you're doing it to please somebody else, or you're doing it because you think you should do it, but it's not really what you want to do, then you don't feel in flow, right? But if you know, I am doing this because I want to look after Cassie and Lucas' children whenever I'm older, that is the thing that will get me to put my runners on, that'll get me to go to the gym on the days I don't want to, that'll get me to eat healthy and not stick something in the microwave that's ultra processed. That, you know, once you lean into your own why and your own purpose, that all the rest becomes easy. But some people don't stop to think, well, what is it I want out of my life? What is my purpose? Yeah. And you should really take some time to think about that. And the thing is, your purpose changes. Like when I was growing up, my purpose when I was here in this bedroom growing up was to get out of here and get to Dublin and have a bit of crack and meet people and all of the rest. And my purpose in college was probably, you know, to meet lots of different friends and all of that. Then my purpose whenever I qualified was probably to settle down and meet somebody that I could share the rest of my life with. And then when me and Ronan got married, my purpose probably changed to I wanted to be a mum. I wanted, you know, and now that my kids are growing up and don't want to spend that much time with me, my purpose has changed again, where I want to spend more time with my parents. You know, so your purpose changes as you go through life. And you need to take some time to think about that and think, okay, well, what is it that I want to achieve? Because once you know what that is, Trisha, it's very easy to make better health decisions, because then you realize, do you know what I mean? Like, so we talk a lot about purpose and your own values. And then the other thing is the environment. And we talked a little bit about that. So this is like things that are in our environment that cause poor health outcomes. So we talked about pesticides and all of the rest that they're sprayed onto our food, but it's also like things that we apply to our body, like the makeup that we use, the perfumes. That's the worst. Perfumes are absolutely worst because they don't declare on the back of packages what's in the perfumes. And yet where do we spray our perfumes? Right here, right here, right here, right here, on our lymph nodes, Trisha. Our lymph nodes that are supposed to clear toxins from our body, and we're spraying a load of chemicals in.
So what do we look out for buying perfume?
You look at the packet, but most perfumes will not declare what's in them because that's their secret recipe for their scent. Yeah. So they are the worst offenders, perfumes. So like try to get something organic, you know, essential oils, you know, if you want to go down that route. Or if you are going to use a perfume, don't spray it directly onto your lymph nodes. you know, spray it onto some clothes or whatever, or a tissue or a handkerchief, or, you know, your cuff of your sleeve or so, but just don't, because like, think about it. Like, look at, I give you a good example, HRT patches or estrogen gel. We put that onto our skin, and that estrogen is absorbed through your skin and into your circulation. That's what makes it very effective. So think about that. We're putting drugs onto our skin to have a bodily impact. Yet we put body lotions onto our skin, deodorants under our arm full of aluminium, perfumes onto our lymph nodes that are full of chemicals that we know are toxins. And we know, if you look them all up, these parabens and, you know, phthalates and whatnot that are in the products that we use day to day, and we are putting them onto our body to be absorbed into our body. So, and what happens when they get absorbed into our body? They cause inflammation. Again, inflammation. And we see this rise in inflammatory conditions, whether it be autoimmune conditions, lymphomas, blood cancer, which is directly into the lymphatic system, Trisha. So when we talk about environment, it's about that conscious use of chemicals in our day-to-day life, as well as microplastics, Trisha. Like, they now have discovered that most adult humans have a credit card of plastic in our brain.
That is...
In our brain, Trisha. We have found microplastics in our, you know, our little, like in our ovaries, in the eggs in our ovaries that we are going to ovulate and have a baby with. They find microplastics in our little eggs, because we are born with the eggs that we are going to have for our adult life.
Wow.
They have found plastics, microplastics in those.
That is so
terrifying.
Terrifying.
So our use of plastic, so storing food in plastic containers, heating foods in microwaves in plastics, seeps those plastics into our foods, you know? And as a result, those plastics get into our food, and then we consume it. And they get into our body, Trisha, and they just don't stay in our little gut. They travel the vagus nerve into our brain. That's why we have a credit card full of plastic in everybody's brain. It's like absolutely mind-blowing.
And you cover, sorry, and I know this is about Symprove this life, but it's actually mainly, I think the whole thing you spread is health. That it's not. So I'm loving this part here. But the Pharmacy 360 that you do, I know you do with the wonderful Miriam Hussey. Is that something that anyone can avail to look at? Like, could we do a live on that? Because I think that this is so beneficial, because it's only when you're stopped and told how severe it can be that...
Oh, it's scary. It's scary. Do you know
plastic containers, I'm brutal. I'll make a chicken curry, I'll put it in the container, and I will reheat it in the microwave without thinking. But I'm being healthy, batch cooking. But what is it? The devil is in the dose.
And it's the same as what I find with the fruit and vegetables. We think we're doing really good, and we are doing. Everybody's just trying their best here, Trisha.
Yeah.
We're all just trying our best, yeah. But then you're just not aware of actually all these chemicals that are on our fruit. An apple a day keeps the doctor away, but it's covered in all sorts. It's part of the dirty dozen, like. So we got to wash it. We got to whatever. So, and the same, like you say, you're batch cooking. You're doing everything all on a Sunday night, but then you're sticking it into plastic containers. You stick in the freezer, and then you're going to heat that in the microwave, seeking in microplastics into your food.
So would you go glass and reheat it in a pot?
Glass, absolutely, glass or ceramic. Yeah, and there's
loads. Well, I'd prefer glass anyway, but
yeah. So So and the same glass water bottles. Yeah, anything that doesn't have microplastics or BPA's in it. Yeah, there you go.
Like, I need to go.
Do you know when you start becoming aware of this, Trisha? It's like putting on a pair of glasses and you see it everywhere, and you kind of go, "Oh my God, I've been doing this," and then you start feeling a huge amount of guilt. Don't feel guilty. That's the one thing. We have no time for guilt. There's no point looking in the rear view mirror. We have to go straight ahead.
Yeah. To raise your cortisol, it's all trapped. So just do it.
Just like draw a line in the sand, and all we can do is the best we can do with the information we have. Once you have the information, then you can make better health care decisions, if that makes sense. So what I would say, anybody who's interested in Pharmacy 360, go onto our website, type in Pharmacy 360. We have loads of content there already on nutrition, food, you know, movement, so on and so forth. So all of the elements are covered. We're actually covering off environment at the moment. So Liz O'Hagan, she's one of our pharmacists, she's heading it up for me, and between herself and Miriam and myself and a few other people, we do the content on different topics around this. Actually, Pat Kane, I don't know if you know her, she's an amazing girl. Do you know her? So she's going to be doing some because she is phenomenal about plastics and microplastics. So she's going to be doing some educational videos very soon for us on that. And because she looks at this from a sustainability point of view, that's her kind of, she's a sustainability consultant. So she's like looking at it from a more an environmental point of view. But actually what she has discovered in all of that journey is just the amount that we're consuming. So she's going to do some content with us on that point as well, because don't forget, whenever you're not using plastics, that's much better for the environment as well, you know. But more importantly, if you want to be really selfish about it, you know, whatever about the environment, it's about your health. It's actually about your health. Do you know what I mean? So try and, you know, and sometimes it's not possible. Sometimes there's, but you'll see in supermarkets now, they're using less and less plastic even to cover the vegetables. You'll notice it whenever you go in next time into, you know, good supermarkets who are on this sustainability journey themselves. You'll see that they're actually using less plastic, you know, from an environmental point of view, but you'll actually notice it even less on foods like such as fruit and vegetables. They'll actually have it out on display that you take it off and you put it into here. So that's why the people are becoming much more aware of the harmful effects of plastic on our bodies as well.
It's fascinating. And I think anyone, actually, before we wrap up, we'll give it another few minutes because someone said, how do you both have the energy to stay this concentrated for this long? Imagine. Symprove. It was just, I suppose, like I find with the last couple of years and the whole journey is, it keeps, like you said, you have the right to change your mind. Now I'm like, okay, yes, there's weight loss, but there's health gain. What can I do that I'll feel better next year, 10 years, 15 years? What movement can I do that I can put on my clothes do you know, that it's not all, it doesn't have to be a punishment. It can
Oh
be a
no.
reward every day to get up, to make my decision, have my Symprove, go to the bathroom, get my breakfast, have a gorgeous cup of coffee, sit outside for 5 minutes, get sunlight. All of those things are not punishment. They're all for me. I'm like, look at my cup. It's so full. And I'm not just saying that because we're on a live. If we have a cup of coffee, I am this grateful
Yeah.
that there is actions that I took 6 years ago that have led me to where I am today. So what actions can I take today that'll lead me for 6 years' time? And if I could give anyone the chances, no guilt, no shame, no anger, no regret, just get up in the morning and be like, come here, I'm alive. I'm one of the fucking lucky ones.
Gratitude.
What can I do? And that's what I think with you, you always drove that message home to me. You've never really cared how much weight I've lost. You've always asked me the
I don't
question,
think I've ever
and
asked.
no, you're like, and how are you, Trish? I'm like, do you not want to know? And you're like, no, but how are you actually? And I think that's the key to anyone in life is, how are you? If you're not great, maybe have a look at what can you do for yourself. That's what I would think. And that's the message I would drive home. Because even when we did the Camino last year, you kindly gave everybody a week's supply of Symprove.
Yeah.
The amount of people to this day that is still on it, because they were like, even the simple thing of getting up in the morning, that ritual, that it's like, I've ticked one thing. I've done, because some people don't have time to do stuff for themselves.
Yeah.
That was the one thing. And that was the stepping stone to them going, I'm going to go for a walk. I'm going to listen to a podcast. That's what I think it's about. If anyone has any questions, please throw them in. But I'm just going to run through the three flavors because a few people asked that. You
Yeah.
have got original,
Yeah.
kind of tastes grand. It's
Yeah.
like, it's
If
not,
anybody doesn't like flavors, is what I'd go for the original
yeah,
flavors. If you don't normally like, but the other two flavors, just to say, they're not artificial flavors. There's a different flavor in these, and they're natural flavors. For example, black cherry juice is a flavor in the strawberry and raspberry, believe it or not.
wow.
So yeah, I know. And I would go for children. I would go for the strawberry and raspberry because Trisha, you know from the two flavors, it's less sharp. The mango
Yeah.
and passion fruit is a little bit more acidic to the taste. It's probably still the most popular actually, but if you don't like that sharp taste, then go for the strawberry and raspberry. It's a little bit smoother, and definitely if it's for children, I definitely would go for the strawberry and raspberry. They're more inclined to take it if it's strawberry and raspberry.
So the way the offer is working, I'm going to share the link in my story after this. And a lot of people ask, can they rewatch this live? And it's definitely one I'm going to rewatch. And I think with lives as well, pop it into your earphones and go for a walk instead of just
Yeah,
sitting on your phone. Actually, sorry, there's something I just want to say. I read something scary the other day. You know, like time is flying, and you're like,
yeah,
oh my god, how are we June? How are we July? How is it August? Blah blah blah. If you spend 3 hours a day, just say this is your phone, and you just spend 3 hours of screen time, whatever it is. That is the equivalent of 45 full days in a year of this.
Right. Oh my God.
Frightening. So if
Yeah.
you are consuming social media, do it on a walk, do it something, because it's literally just, it was just something that frightened me, because so many times I could be there 2 hours later, I'm like,
Yeah.
I had no time. And I'm like, but I just give it all. So just even though as an influencer, I'm like, walk out the door with me.
Yeah.
So it is 25% off until the 30th of June to
Yeah.
celebrate World Microbiome Day.
Yeah.
That offer won't be back to me till at least Black Friday. And
Yeah.
that's something people, so if you want to top up, what is the shelf life date in it? Because it works out as €1.66 per day. And you're very fast at shipping. If they put the order in tonight, more likely DPD have it tomorrow afternoon to
Yeah.
go out.
Yeah, tomorrow it'll be with DPD and you'll get it the following day. So Wednesday, then you should get it. And the shelf life is March 2026. So it's got a great shelf life. Yeah, yeah. So yeah,
But
so even
definitely
if you've
stock
got a
up.
couple of boxes already at the house, it's a good time because you're dead right. It'll be Black Friday before we do 25% off because it's like €50 off the 12-week program. So it is because it is more expensive. Absolutely, it's more expensive. And Trisha, the reason is, like we said at the beginning, it's not freeze dried. This product can't be made in huge warehouses and stacked on the shelf because the bacteria, because they're live and because there's no preservatives in them to keep them alive, it's completely natural. It's not freeze dried like you find in capsules. That when you freeze dry a product, it can last for up to 5 years. So because Symprove
They can
can't,
make massive bunches.
yeah, exactly. They make massive bunches, whereas Symprove, they can only make it. They make it every Tuesday. Well, actually, they make it much more than every Tuesday now, 3-4 times a week now, and they can only make a certain amount at a time because the bacteria will only stay alive for less than a year, if that makes sense.
I have 3 new video ideas, and I love this. Anytime I chat with Una, and I'm like, can I come to the warehouse and do supermarket sweep? But I want to do a Pharmacy 360 cover. I want to
Right.
do a seasonal video on the Dirty Dozen because that blew my mind there. And then I think I'd love to go and see how they make Symprove. I want to see
No
it.
problem.
So,
Come with us the next time that we're going to cross. We will be going to cross, I'd say, at the end of the year. We always go to find out the new research and development and get the
yeah,
update from Barry himself and everything. So we will definitely be going over. And you come with us. You can walk around the factory. You can talk to the production manager. You can see how they
yeah.
take the bacteria and grow them, how they put them into the product. Like you can chat to them about the whole thing. They're amazing. It's amazing to actually see, and it's amazing to hear the research. The research that's coming out on Parkinson's is mind-blowing, Trisha. When that comes out, I can do a live on that. It's absolutely amazing because all of this, what they've discovered, actually starts in the gut. It's
Yeah.
this protein. Remember I said to you that sometimes the gut lining separates and things get out of the gut that shouldn't get out
Yeah.
and travel the vagus nerve. Well, they believe now that this is a curly protein called alpha-synuclein that escapes the gut, travels the vagus nerve and deposits in the brainstem, and builds up over time, which contributes then to the onset of Parkinson's. So they now believe that Parkinson's is not something that's happened in the brain, it actually starts in the gut. And actually, the guy who is heading this up, he's like the #1 professor in the world in Parkinson's. He's running the 2 clinical studies. They've been written up. They will be published really soon. But he also said that if it works, if this is the same mechanism that's happened with Parkinson's, he believes that actually he's got a neurology team looking at this now for MS, for motor neuron disease, and also for Alzheimer's. Because don't forget, in Alzheimer's, you get this buildup of amyloid plaques in the brainstem that actually causes Alzheimer's. And then you have this inflammatory condition in the brain. So it's all about taking down inflammation and clearing those amyloid plaques for patients who have Alzheimer's or dementia. But it's like, what causes the plaques? Well, they now believe actually it's things that escape the gut and travel the vagus nerve. So it actually all comes from our gut. And if our gut is working effectively and is not leaking and things not traveling out, like we talked about at the beginning of the life, then as a result, if they don't get out, they can't travel the vagus nerve and they can't cause all these deposits.
That
So
is, it's amazing. Now, and I'm going to ask anyone who's viewing this, if you've shared the live, pop in the word shared. But can you also pop in what live would you like Una to cover? Because you're a foundation of knowledge. I love it. And what did you learn from this live? So I think that's really important because there was so much for me that every time I chat with you, I'd say you never sleep. Are you just reading? I have a feeling you're just lying in bed with this like screen being like, there. Do you know, it's just, I love it. I love it.
It's because I get a privilege to working with amazing researchers and developers who are at the cutting edge. It's like what's going to go on Wednesday night. These are three professors who are working on like what's going to come out in doctors prescribing in probably 10 years time. So they're at the cutting edge. Like, you know, it takes 10 years for nearly what's prescribed to catch up with what's been discovered in the labs, you know? And that's what drives me mad sometimes. Like, patients go to like their doctor and kind of go, oh, I heard about the microbiome, whatever. Either A, they don't know, or B, they kind of go, oh, that sounds a bit wishy-washy, or that's a bit whatever. But actually, they are not aware of what's going on in terms of research and development right now, because whenever they went to college, they like it wasn't a thing. When I went to college, Trisha, we didn't learn anything about the microbiome. Nothing.
Isn't that mad? And how long ago were you in college?
20 years. You would have to ask me.
I'd have said 3.
Actually, 25. No, I'm qualified. Oh, Trisha, I bought the pharmacy in 2001, so that's 24. I'm qualified 30 years, Trisha. 30 years.
Well, if you were looking like that, I wouldn't be hesitating on buying this. I'm literally like, go. There was so many things coming in there. It's about Pharmacy 360, plastics, kids, probiotic birth. People have learned, which I think is just always your number one goal. Now, my number one goal is for people to buy. No, but it is. If somebody wants to pick it up, they don't need a code. I will share the link. It's 25% off until the 30th of June. That'll give you your whole thing for €150 because you give the last 4 weeks for free, which is €1.66 per day. I just think that if anyone is hesitating, get it. If anyone's on it, I know they're going to buy 2 or 3 boxes because you have March 2026 on it. I think that was a question that I have in my head as you're on about berries. Frozen berries. Do I need to rinse them?
Well, you know, before they get frozen, you don't know if they've been organically farmed or not. Okay, so I don't know. I have not come across them, but I'm sure there is, and maybe your followers would know this. Is there an organic frozen berry brand? Perhaps there is, because if that's the case, there's no synthetic pesticides and herbicides and chemicals on them. However, if it's not an organic farmed berry, then you have to assume that there were chemicals used and sprayed on these. And the question really is, before they freeze them, do they remove those? My guess is that they don't. So what I would be doing is defrost them and then go through the same process.
Okay. I know that because I always wonder at that.
Yeah, unless you're clear and unless it's very transparent, I would assume the worst and I would take that extra step, because generally speaking, if a brand goes to that length, you know, and it is organic or they have removed whatever, they will say it, because that is something that most brands don't do. You know?
Okay.
So unless it's on the pack, it's very clear, it's very transparent, I would assume that care hasn't been taken in here.
And also, another thing that I realised only a couple of weeks ago, because you were on about it, there's 185 milligrams of vitamin C per shot. So you're also getting vitamin C when you're taking your Symprove.
Yep, you are indeed. There's a little bit of vitamin C in there. Yep.
Love that. So what I'm going to do is, Linda would love if we did a podcast, be about 27 hours long. We'd be like, we need to take a break, Oonagh. It's 4 days later.
The studio would be like, can you sleep now, please?
Yeah. I'm like, I'll have a bed. So what I'm going to do is I'm literally going to fly through it and pick the winner of one. And if you are picking it up, definitely go through the link. You don't need a code, but if you're picking up, like there's other supplements you do, Revive Active, you've collagen, the amount of things on your website that I always say to people, if you think of a pharmacy, that you're going into the pharmacy, you're picking up a bottle of fake tan, a probiotic, vitamin C, just think Meaghers. Because in fairness, you are an Irish brand, you support Irish, like it's insanely amount of Irish brands, and use the code Trish15 because I'm Irish.
Yeah. Somebody else.
I'm going to just fly through these
here, Trisha, in case we missed a couple of questions. So somebody asked about, can you take it when you're breastfeeding? Yes, you can. And when you're trying to conceive, and when you are pregnant, it's safe to take in pregnancy as well.
Okay, amazing. Sorry, I'm just flying. The page is freezing. Jesus, there's a lot of things in it.
Yeah. There's loads of questions. If I didn't answer your question, I'm sorry, I'm not being rude. Just DM me after this. Trisha will share my handle or whatever, and I'll come back to you. I'm really sorry. There's loads of questions there, Trisha. Sorry.
It's insane. I think I got most of them. But the winner is Neil Mairead. Wait, now pin that comment so then I can screenshot that and we're sorted.
Right. And will I send would the winner like to contact me and I can send a free 12-week program to you, or what way do you want to work it, Trisha?
Because the control freak in me, I will contact Mairead, get her address, and I will CC both of you in an email. Because then I know I'm done. After that, I'd be like, it was nothing to do with me. Because I hate, people do giveaways, and sometimes they'd be like, who won it? I'm like, it's all in an email and it's CC'd. It's above. I am not scamming people out of Symprove.
Right, okay, good. Yeah, okay, right. Okay, whatever way works best for you. No problem at all. And congratulations to the winner. Yeah.
Yeah, amazing. And I mean it. Thank you so much, because there's so much you can learn from other people. And your Pharmacy 360, we're going to do a seasonal video.
Yeah.
Follow your Instagram page. Follow Mars. And that's what I love as well. Like a couple of times my sisters would be like, will you text Oonagh and ask her what this is? And I'm like, no, because that's just service at marspharmacy.ie. Anyone who messages me random questions and I don't know the answer, the feedback that I get from them doing that is insane. It's efficient, it's fast, and I love that there's always a team of you ready to answer. So don't be embarrassed, don't be shy. Everybody has things. Everybody has things.
Yeah,
And just go for it.
absolutely. And there's people on this live, I know for a fact you don't want to ask a question publicly here because you might be embarrassed or you might not want to mention the medicines that you're on. And that's completely, absolutely normal to feel like that. So just send me a DM. You might have a question about specific medicine. We talked a lot about mental health. People still feel that there's a bit of a taboo around mental health. Yeah. We all suffer from our mental health from time to time. I know I do, Trisha. I know that you've said in the past before you do. Yeah. For whatever reason, we feel embarrassed about this, or again, I find this with a lot of parents who might have neurodivergent children or might be neurodivergent themselves, either have ASD, or ADHD. No, don't feel embarrassed about this, but I get it. If you don't want to ask a question publicly, just send me a DM. There's nothing better for me personally if I feel like I can help somebody. That's the thing. It gives me the buzz. I don't know why, but I just love that. So send me a DM. There's no question that is too big or small. Yeah.
Lovely. I was in Beckett Street the other day. I popped in, I wanted to buy, it's gas. I have a code. And I was like fucking, I totally forgot to order electrolytes. Because I need to get electrolytes, and I knew you'd put it up on your story. There was new Zuki ones, so I was walking along and I was like, you have the little travel packs.
Yeah.
But even when I was in there, it was the service that I got at the counter was so lovely. And I could see there was a young pharmacist kind of chatting to a woman. He was like, it's just simple things like, what else can I do for you? I just think, and I know you know it, your team is amazing. And that comes from you. So thank you. It's always fabulous.
Thank you. Well, no, they're brilliant. They say to me that they just roll me out and stick me out there, but they are actually the people behind the scenes that are amazing. So I'm blessed to work with them. Very blessed. So, but thank you for saying that, and thank you for popping in. Thank you for shopping with us, Trisha.
Yeah, and I was like, at the children were like, do you have a loyalty card? And I was like, oh, for fuck's sake, but I was like, I have a discount code. But I didn't say that. And I was just like, no, but Oonagh owes me 15%.
Well, I hope they looked after you. I'm sure they did.
They did. Come here. Thank you. I'll get in touch with Mairead. 25% off Symprove. Shared live. Away you go. And thank you. Goodbye.
You're welcome.
Bye, my love.